Hi, everyone. How are you? Shall we talk about dipyrone today? Almost all of us have a bottle of dipyrone at home or pain relief pills, right? Did you know that dipyrone is one of the most widely used medications in the world? It is a non-opioid analgesic used to treat pain, inflammation, and is very effective in reducing fever. An important detail: dipyrone can even be used by cardiac patients admitted to ICUs. It can be used by people with hypertension, by those who have had a heart attack or are at risk, and by patients with heart failure. In other words, dipyrone can replace anti-inflammatories in many cases, especially for cardiac patients. Remember that if you have any cardiovascular disease, you should avoid using anti-inflammatories such as diclofenac, ibuprofen, and nimesulide, among others, as much as possible. So, stay with me until the end of this video to learn everything about dipyrone, what it is for, how it works in your body, and the side effects you never imagined. Let's go. Have you subscribed to the channel yet? If not, subscribe and activate the bell to receive notifications of all my new videos. And like the video. When you like it, YouTube understands that the content is being useful and shares it with more people. Why did I decide to make this video? I always say that patients with cardiovascular diseases should not use anti-inflammatories, as they can increase the risk of other cardiovascular diseases, such as strokes and heart attacks. But what can a person with cardiovascular disease use when they feel pain or inflammation? One alternative is dipyrone, one of the best-selling medications in the world. Dipyrone has analgesic, antipyretic, and anti-inflammatory properties. It can be used for various types of pain, headache, joint, and muscle pain. In addition, it reduces fever and acts as an anti-inflammatory. It inhibits the production of prostaglandins, substances involved in inflammation and pain, by acting on the enzyme cyclooxygenase, COX. Prostaglandins regulate body temperature, cause vasodilation, and sensitize pain receptors. When an injury or inflammation occurs, cyclooxygenase is activated and begins to produce prostaglandins, increasing pain, inflammation, and sometimes causing fever. Dipyrone inhibits COX, reducing prostaglandins and, consequently, pain, inflammation, and fever. Although its anti-inflammatory action is not as potent as that of non-steroidal anti-inflammatory drugs, such as diclofenac and ibuprofen, it is preferable for people with cardiovascular diseases to relieve pain. As a cardiologist, I prescribe dipyrone for pain even in patients admitted to ICUs after cardiac procedures or surgeries. It is a safe medication. Anti-inflammatory drugs can increase the risk of cardiovascular events in patients with a history of heart disease, such as heart attack, stroke, and heart failure. They inhibit COX, affecting the production of prostacyclin, which has vasodilatory and antiplatelet properties, helping to prevent blood clots. In patients with cardiovascular disease, anti-inflammatory drugs can reduce the production of prostacyclin and increase the production of thromboxanes, prothrombotic substances, increasing cardiovascular risk. Therefore, patients with a history of heart attack or other heart disease should avoid anti-inflammatory drugs and use painkillers such as dipyrone in adequate doses and for short periods, always under medical supervision. Dipyrone is safe, but it can cause side effects and interactions with other medications. It can cause severe allergic reactions, such as anaphylactic shock, hives, itching, redness, swelling, and difficulty breathing. It can also cause gastrointestinal problems, such as nausea, vomiting, stomach irritation, abdominal pain, and rarely ulcers. In high doses, it can affect the liver and kidneys. Dipyrone can interact with anticoagulants, antihypertensives, diabetes medications, and other painkillers. Always tell your doctor about all medications you take before using dipyrone. Fun fact: dipyrone is not sold in the US, but it is used in Europe, Latin America, and Asia. In the US, other painkillers are used, such as paracetamol, which can also be used by heart patients, always under medical supervision. Paracetamol does not have as strong an anti-inflammatory effect as dipyrone, but it relieves pain and reduces fever. It should be used with caution in patients with liver disease and can cause excessive liver damage. If you liked the video, share it with your friends, especially those with heart problems who use anti-inflammatories. Could even save a life. Until next time, a big hug.